So this video is a bit overdue. I know a lot of other people that I've seen on YouTube, at least maybe you guys haven't, have done a COVID kind of post symptoms, reactions to both vaccine, the first dose and the second dose, depending on which one you got. And mine is very long overdue with good reason. But here it is. I'm going to try and make it short and sweet. I got my first dose about 5 days ago at the time this is being recorded. I don't know when it'll end up going out, probably in a couple of days from now. So it might be about 10 days, a week, whatever it may be, when this video comes out and you're seeing this. But I just went to the ER because I had some tightness, shortness of breath, kind of like an elephant was just kind of sitting on my chest. I mean, I have had asthma in the past, and I grew out of it with puberty and good time. And I'm pretty athletic, generally in shape, not like I'm a showboat or bragging, but I've just been in generally good health. And yeah, I had some serious chest pain today and some shortness of breath, tightness, kind of like I had asthma again. It was hard to get a deep breath. It hurt in my lower back. So I just came from the ER. It is midnight at the time that I'm recording this, and I had been there for roughly 3.5 hours. So yeah, everybody reacts differently. Some people don't have any reaction. I have a lot of family members who haven't had any reaction at all. And I've had a lot of people who have had a decent reaction, a mild reaction, maybe some arm soreness, which I had as well, which is totally common for almost everybody, It's a big old needle, and then I've had people who get a rash maybe in their arm, or they get a headache, or maybe a fever. Cough is pretty common. And then people who have very severe reactions, they pass out, maybe not because of the needle or maybe a fear of them, but really because of, the reaction or something like that. Although it's pretty quick. I had a friend who did pass out and ended up having a big old rash and a fever and some vomiting and stuff like that, and was brought into the ER for a similar reason. And people, this isn't to bash anything. Totally get your vaccine. Believe in the science. It helps. If you don't want to get your vaccine, you don't. I'm not telling you what to do. You guys can really, make up your mind if you want to. I'd waited a while. The vaccine's been out for a while, and I just decided to wait. Now I'm getting it, and I'm putting this out just because I still have my arm band where they drew my blood. At the time I'm recording this, I have my little sticker that says ER, just as when I signed in, and I have a little bracelet that says that I was enabled in the ER. I'm not going to show that because it has a bunch of personal information on it. But yeah, a lot of people have different reactions, and a lot of people don't have reactions, but some people have severe reactions. I saw a post just recently when I was doing some research before, so maybe about a week ago, I did some research trying to see what the most common side effects were and stuff like that, and I realized there was a man in the UK, if I'm getting the story correct, who had the first shot of Pfizer and developed some Bell's palsy, so his face was drooping on his left side, like facial paralysis, partial, so I guess semi, half face paralysis. And he had droopiness of his cheeks, and he couldn't really control his eyes or movement and stuff like that. And of course, that wasn't super common, and I don't know if it's totally related to the vaccine, but the UK news article came out, and I saw that was one of the first articles linked when I looked up like potential Pfizer side effects, potential vaccine side effects, or vaccine news, and articles came up and stuff like that. You can do your own research for sure. It's always nice to be informed. It's always nice to know before you make a decision. You don't really want to go in big with something like this and just say, yeah, sure, I'll get it, because other people did. If you are going to get it, you can do your research. If you don't want to do your research, of course, if you do want to go all in and you trust it and you don't think there's anything, yeah, sure, I just wanted to see potential side effects so I know what to look out for. My immune system isn't the best at most times, so when I get a vaccine, I tend to get like a sore arm, and I tend to get maybe a fever or a headache, or something like that, and that's pretty much it, and then it goes away after a couple of days. But yeah, this was kind of more, I was right at work. I'd been there for about an hour and a half, got pulled out. It was just terrible. I had, chest tightness, shortness of breath. I wasn't able to take a deep breath, back hurt, right up near my left side, left upper lung kind of area, and I got an EEG, or I ended up doing an EKG, a chest x-ray. I ended up taking some pain relief, some pills, and now I'm feeling a little bit better, but yeah, it was pretty scary. And I'm obviously going to got to talk to my primary care physician to see what I'm going to do about the second vaccine, because that kind of thing should be, more or less monitored. If you had a reaction to the first vaccine, you're most likely going to get a second one for the next shot. And so I need to see with my primary care physician to see what he thinks. And yeah, I might take this off. But it is nice to be home now after 3 hours. The phlebotomist was great. I have a video coming out about that, and I'm very excited because I plan on being phlebotomy certified. So I'm going to do kind of a day in the life going through the class. It's a 32-hour course, and then I have to pass that national exam. Man, my hair is rough. And it's in about 5 minutes now, so I'm going to try and hurry this up. But yeah, it's about 40 hours worth of work. Clinical, you need like 35, and then 5 hours clinical work or something like that, and then you got to pass the exam. So I'm going to go buy some scrubs. We're going scrub shopping. I might do day in the life, weekend life. I'm going to try and job shadow. We're getting stuff out. almost the end of summer. School's starting back up, trying to do some research. We're going to see what happens there. But yeah, I just wanted to update people so they know my vaccine side effects. Went to the hospital for a little bit. You can see in the thumbnail, I was able to snag that picture right after I'd taken my medicine. About 45 minutes later, I was feeling a little bit better, which is very great. My pain had gone down. I'm going to switch hands here. I'm trying to fix up my hair, man. That's really bothering me. But anyways, that's it. Thank you all so much for watching. Let me know if you had any side effects in the comments below. Maybe it was better than mine. Maybe it was worse than mine. You didn't have any side effects. Maybe you passed out. Maybe you had a rash or a fever. Felt like you were going to throw up or did throw up or something like that. So let me know in the comments if you did have a similar reaction or which vaccine you got, because there are a couple of options out there, J&J, Moderna, Pfizer, maybe even a fourth, I don't know. Thank you so much for watching. If you enjoyed, drop a like, drop a subscription. Make science-related videos, post them every week, post a couple shorts, post challenges, post puzzle-solving videos, because that is something I like to do in my free time, kind of to keep me preoccupied instead of constantly studying, doing like study with me, day in the life, study for exams, study for midterms, stuff like that. I like to do a little bit different, switch up videos. So yeah, definitely subscribe, keep an eye out for those, and I will see you all in the next one. Peace.